Hello, this is the PG-SGA scoring guide. We're going to go over how to score the PG-SGA. You'll notice that there are 2 pages to this worksheet. The first page should be filled out by the patient and scored by the clinician. Do not score the PG-SGA in front of the patient. The second page will be filled out by the clinician with the patient's input. Let's go ahead and begin with an example patient and start in box 1 on worksheet 1. As you can see, the patient tells you what they currently weigh. They write their height and what they weighed about a month ago and what they weighed about 6 months ago. This patient indicates that their weight has not changed in the last 2 weeks, which may prompt you to want to put a 0 in box 1. However, if we turn the worksheet over, we can see that we want to score that weight loss because we saw that there was weight loss over the last month. When we do that, we see that there was a little over 3% of weight loss in the last month, which would give us a score of 2 for this piece of the worksheet. So this would be additive. We would want to put a 2 here. However, if their weight had decreased in the past 2 weeks, we would actually put a 3 there because these boxes are additive. Now let's go to box 2, food intake. The patient will also fill out this part. Unlike the prior box, this is not additive. We can see that the patient was eating less than usual and very little of anything. This score would be a 4. It would not be a 5 because it is not additive, and the highest score goes in the box. Looking at the nutrition impact symptoms. It's important to remember that these are symptoms that occurred during the past 2 weeks. They don't need to occur every day for them to count, just at some point during the past 2 weeks. And our patient fills this out. Now this piece of the worksheet is additive. So given what we have here, we would want to put a 3 in this box. Then our patient lets us know over the past month how they would rate their activity level. It's important to remember that bed rest is associated with loss of muscle mass. And we score this as well with a 1. Now that we have all the boxes scored, we'll add them together to put at the bottom of the worksheet here, and we get a 10. Flipping this page over, we have the next piece of the PG-SGA. Let's focus on worksheet 2, box 5, after we move our score up here from the prior page. These are diseases that are related to nutritional requirements, and we would add a point for each of the conditions. So in this case, the score would be a 2. Let's go to the next box. This is about metabolic demand. In this box, it's important to remember that we're scoring fever intensity or duration, not both, but whichever is greater. So let's have our example patient say that they had a fever that was greater than 102 degrees Fahrenheit, but it lasted less than 72 hours. We wouldn't add those 2 together. We would want to go with the higher score in that case in regards to the fever. So that would give us 3 points. But let's say our patient also indicated a moderate dose of prednisone. That would mean our score would be additive for 5. We do want to include prednisone or other corticosteroids in that score. Now to the next piece, worksheet 4 or box 7, which is the physical exam. It's really important to remember here that muscle deficit loss impacts the score more than fat loss. You relax when looking at this page. There are a lot of things that you could assess. You don't need to assess them all. These are just examples of areas that can or should be considered, but you don't need to assess them all to have a sense for global loss or deficit of muscle or fat. So here we check over our patient. We see some muscle loss in the temples, the clavicles, the shoulders, We didn't look at their thighs, and that's okay. We still get a sense of the loss. And we also look at their fat loss and any fluids they may or may not have. It's important to remember that this is not additive. So even though we have a global fat deficit rating of 1 and a global muscle status rating of 1, really this is a mild deficit and just a total score of 1. So we put that score there in box D. Now that we have all of our scores, we can add them all together to get the total PG-SGA score. Here, 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 and here. And that gives us 18. Down at worksheet 5 at the bottom left-hand corner, this is where we're going to make our subjective assessment and our call on what stage that this person is in. There are 3 stages or categories here. Stage A, which means our patient is well-nourished. Stage B, which means our patient is moderately malnourished or suspected to be malnourished. Or stage C, which would indicate our patient is severely malnourished. If you can recall from our example patient, we had weight loss, but it was less than 5%, and there was definite decrease in intake. There were the presence of nutrition impact symptoms and evidence of loss of muscle mass in the physical exam. This may indicate to us that we would want to stage the person as moderate or suspected malnutrition. So we put a B in our global PG-SGA category rating. Given that our score above from all of our worksheets is 18, we look down here at the bottom right-hand corner, and you can see that if you have a score of greater than 9, this indicates a critical need for improved symptom management and or nutritional intervention options. The clinician filling out this form would really want to alert the healthcare team that an intervention is needed regarding nutrition for this patient. Now let's talk about some common pitfalls and how to avoid them with this form. Let's say that the person tells you that they did have weight loss, but maybe it was intentional weight loss and they were part of a weight loss program. You may want to take that into account before scoring. Likewise, let's say there has been recent weight gain, but you note that the person reports to be on steroids or recent administration of IV fluids. You might want to use the 6-month weight loss in that case because it might be more applicable to get a better picture of malnutrition, considering that recent weight gain is likely not from food intake. Remember that the nutrition impact symptoms only are scored as they relate to eating, and they're from the last 2 weeks. So let's say the person or your patient marks that they have had fatigue or pain, but they indicated that was in the knee or toe, but it did not impact their eating. Don't include those items as part of the score as they didn't impact nutrition or eating. And if the person did have diarrhea but only had 1 bout of diarrhea last week, you want to count that. Remember, it doesn't need to occur every single day within the last 2 weeks, just at some point. Finally, remember that a person can be obese and still be moderately to severely malnourished. Ensure that you do not make preemptive judgments based on weight bias when filling out the physical or scoring the PG-SGA. Thanks for watching. We hope this helps you score your PG-SGA tools.